Commissioners meeting, February 5th, 2019.
Good morning. It is 11 o'clock. Thanks for catching up with our 2-hour delay with the weather. Looks like everybody was able to get into town all right today safely. So it's 11 up in Connell. There was numerous off the road and upside down yesterday. So, and even this morning coming down. Anyway, we are here for our February 5th meeting. We have a full complement of commissioners. We have Keith, our administrator, and Karen, our clerk of the board. And if you would stand and join me in the pledge, please. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. We have 2 sets of minutes in front of us, December 18th and January 15th. If there's no adds, deletions, additions, changes, I'll go ahead and sign them. Hearing none. Move us on to a closed record hearing, conditional use permit 2018-07, allowing expansion of a dairy farm. We have our planners with us this morning. Thank you.
Good morning, Mr. Chairman and Commissioners. So this is a closed record hearing on a conditional use application to allow the expansion of a dairy farm to 1,500 head at 433 Desert Road in Othello. This action coming to you is just procedural in nature. The Planning Commission has made a recommendation of approval with 6 findings of fact and 22 recommended conditions of approval. So unless you want to refer this to a closed record appeal hearing, your action today is to pass that resolution that we prepared for you with the recommendation as provided by the Planning Commission. With that, I'll answer any questions.
Questions? Thoughts?
No opposition. Nobody was complaining about it.
No, that is correct. There was no opposition.
And we have 2 dairies within 2 miles of one another, correct? Which is
yes. So typically that's an issue to have dairies within that close proximity. But we did refer this over to the Conservation Board, and they analyzed it. They looked at the wind patterns in the area and the unique topography and everything else, and they had recommended that particular part of the code be waived in this circumstance.
Okay.
Okay. Mr. Peck?
Where's the physical location?
So
433 Desert.
Yeah.
In Othello.
Othello is the mailing address. It is in Franklin County. It's just south of the county line with Adams County. I remember Mail Road. It's one of the crossroads.
It's right on 24, basically. Okay. Right on the.
Yeah, it's 2,500 feet from the border.
Yeah.
So.
Yeah.
So, Planning Commission recommended approval, 6 findings of fact, 22 recommended conditions of approval. Help refresh my memory here. We're doing this as a closed record hearing, not because of an appeal.
Correct. There were no appeals filed. If this commission wants to review the file more in depth and have testimony presented based on the record, we can go through that, but that would need to be at an advertised future meeting.
Well, that's really kind of where I'm going. I'm not opposed to the package or the recommendation, but typically we don't see quasi-judicial closed record hearings except on appeal here. I mean, I'm not saying it's not out of the ordinary. More often, if it's just coming through for an approval of a Planning Commission recommendation, we have a public hearing where people can comment. So we're doing a closed record this time because what?
Because that's what Franklin County Code has
Okay.
has specified in 1782-110.
Right.
It says, unless a proper and timely appeal is filed, or the board by majority vote deems further review is necessary,
Right.
the recommendation shall be effected by proper action
So-
of the board without further
See, that's
review.
really helpful, because if you were to check the history, probably before you came here, we routinely, and I see you nodding yes, we routinely held these as open record public as opposed to closed record. So this represents a change in our practice, but it is consistent with our code. So thank you for clarifying.
Yeah, sure, Commissioner Beck.
Yeah, that was my question earlier, and Keith brought it to me with that explanation, so thank you for your legwork. And no other questions, I'd entertain a motion.
Okay, Mr. Chairman, pleased to move for approval of CUP 2018-07 and CIPA 2018-19 as presented.
Second.
Further questions or comments? Hearing none, all in favor?
Aye.
Aye. Thank you.
Thank you very much.
Thank you.
That brings us on to a public hearing, supplemental budget increase of $363,000 for acceptance of grant from Washington Healthcare.
Yes, Mr. Chairman, thank you. This is a follow-up item. You'll hopefully remember that a couple weeks ago we accepted the grant from the Washington State Healthcare Authority and approved that contract, but we knew at the time that this was going to require a revision to the budget that had been properly noticed in the newspaper. We provided that notice. Course of events is to have a public hearing today to reopen the budget to allow us to receipt that money in as it comes and then expend it as we execute the program in the corrections facility. So before you today is the consideration of that item, and certainly glad to answer any questions that you may have.
Questions?
We will be informed if we are not reimbursed.
Oh, certainly.
course.
Yeah, certainly. That was the agreement in the contract, is they would reimburse us for those
And
expenses.
if we've run into problems with reimbursement, then we can then cancel, correct?
Certainly.
Okay.
No questions, Mr. Chair. If you're prepared, I'm happy to move for approval of 2019-045 as presented.
Second.
No further discussion? All in favor?
Aye.
Aye. And that brings us down to a discussion, heart-to-heart syringe exchange program for Benton Franklin Health District. And I see we have Mr. Dawson here, was first on the list to speak. Come up to chair or?
Have a seat.
Like doctor to come with me?
Sure. So these microphones, you really have to get pretty close to them for people to hear, so
Certainly.
if you're not in jeopardy of hitting it, you're probably not close enough.
Yeah. Thanks, Brent. So I'm not sure where you want us to start or whether we're having a discussion, you have questions.
Well, I would ask that you summarize for everybody's benefit how we got where we are, and in the process, if you would touch on who funds this program and what the health district has presented to the Benton Franklin Board of Health as the reasons for having this program. Essentially a summary and a recap of what you presented to the Board of Health some time ago.
Okay, we can certainly do that. Benton Franklin Health District was approached approximately 2 years ago by Blue Mountain Heart to Heart, expressing interest and a need for syringe exchange services in the Benton-Franklin County area.
Excuse me, just one second. I know this is an issue of a lot of interest to people. I just want to make sure folks in the back can hear. Is that microphone picking him up, and can you hear okay? All right, thank you.
Upon that request, part of the information that was provided to the health district was incidents that citizens from both Benton and Franklin counties were attending on a regular basis, a syringe exchange operated by Blue Mountain Heart to Heart in Walla Walla. Anecdotal information was also provided to us by the Yakima Syringe Exchange that they were seeing Benton County residents at that exchange in Yakima, indicating that there was a need possibly for that type of service here. We embarked on research with our health district, with our senior staff, our health officer, and staff to determine whether or not it fit with our mission and our vision as a health department, and how it fit into public health services. Opioid crisis that we are undergoing in the state of Washington is clearly identified as a public health crisis, not only in the state of Washington, but throughout the nation right now. And syringe exchange fits with the opioid response plan for the state of Washington. Upon doing research, we started looking at what facilities we had as an agency that could possibly support a syringe exchange, not fund a syringe exchange, but possibly support a syringe exchange. Looking at the leased Pasco facility, there's unused space in that that doesn't fit with our business needs at this point. A couple of unused room with a separate entrance from our lobby that seemed to provide a decent area for that type of operation that was private, wouldn't necessarily put exchangers in contact with our WIC clients or any other clients, and would provide them the privacy necessary to do a service. Our agency then at staff level began educating and discussing this matter with our Board of Health. Did that over the course of about 12 months. Repeated presentations by a variety of staff, including myself, Dr. Person, Carla Prock from our Senior Manager for Healthy People and Healthy Communities Division as well, to bringing basically facts and figures and syringe exchange successes across the nation. That, talking about that people who attend a syringe exchange are 5 times more likely to enter treatment. That there has been a noticed and defined crime reduction in the areas where there's an active syringe exchange. That needle sticks in the community actually go down because needles are not thrown on the ground anymore because they're collected. And the other thing, and probably the most important thing, is harm reduction. Harm reduction in our citizens that are suffering from addiction, in that we clean needles help prevent the spread of HIV and hepatitis C and other blood-borne pathogens, because we're not giving the instrument, and they're not having an instrument that they may share, an instrument that may be dirty and they may reuse multiple times, thus reducing the financial burden on the community to care for folks with HIV, with hepatitis C, and also reduces the ability, or not the ability, but emergency room visits for wound infections, because if somebody is injecting drugs with a dirty needle, the likelihood and the potential for having a wound infection increases greatly. Syringe exchange provides some counseling, some connection to get people into treatment. It provides them with the avenues to do it. Doesn't provide them pharmaceuticals, doesn't provide them a safe place to inject. It is an exchange, and it is a one-to-one exchange. And it is cost effective. When we think about the cost of treating an HIV patient, it's about $20,000 a year to provide the medications for an HIV positive person to prevent them from developing AIDS. So it's very, very expensive. The cost of a syringe exchange on average in the United States is about $160,000 a year, and that's plus or minus. So our lifetime cost of somebody with HIV that we're treating, and generally many HIV patients, and we do have a number. We are carrying a caseload at Benton Franklin of over 100 HIV positive persons that we're case managing right now. We would like to stop the spread of HIV, and this is just one of those tools to help in that stop. This is an HIV program or a syringe exchange program going to end drug abuse? No. Is it going to end HIV? No. Is it part of the picture? Yes. And that's, the basics of how we got here. At some point, it would have been in November, I believe, of 2017, the Board of Health was requested to authorize the health district to pursue a contract with Blue Mountain Heart to Heart to operate syringe exchange, and then in January or February of 2018, the Board of Health approved us requesting a authorization from the Franklin County Commissioners to utilize space in the leased building that the health district was leasing from the county, and that approval was received in March of 2018. Contract and MOU was entered into by the health district and Blue Mountain Heart to Heart to operate syringe exchange, to do some hepatitis and HIV testing, including data reports that are required of Blue Mountain Heart to Heart on a monthly basis to the health district. And that opened on May 11th of 2018.
Kind of go along with that, Rick, when I was chairman of the health board at that time. The health board is made up of the commissioners from both counties. I was chairman at that time, and the director of Ben Franklin Health talked to me about this operation. And I said I wouldn't even bring it to my board until we got an input from Pasco PD, the city of Pasco, the sheriff's office, and get the buy-in from all the entities around us. And there was no opposition from any of them. We had a little bit of an opposition from WSU's office right there with concerns of, because there's students that walk in and out of that office at times. Tim Waters, the doctor over there, I think you went with him or got him tied up to go to Walla Walla to look at that program and change their attitude, and along with the employees there. So that kind of gives you a little bit of background of Franklin County side of it.
And we did, as a health district, part of our process was to work with our neighbor WSU, and we did meet with Tim Waters at Blue Mountain Heart to Heart in Walla Walla to review their operation there. And then Everett Maroon, the director of Blue Mountain Heart to Heart, myself and Carla Prock actually spent an hour and a half with the WSU staff answering questions, doing education, and to this point, at least the conversations that I have had with Mr. Waters since have been nothing but positive.
Correct. Also from us that I haven't heard anything. Excuse me.
No,
Go ahead.
Go ahead. Franklin County owns the building. The health department leases the building from us. As I read the lease, if you were to sublet, meaning rent some portion of it to someone, you have to get our approval. If you wanted to use some portion of the space for something outside the health department mission, you would have to get our approval. I don't see that this goes outside of either one of those, so I appreciate you asking us, but the fact is you really didn't need to. It was already within the lease contract. You had the authority to do it. And kudos to Commissioner Cook, who, as chair of the health board, did go and insist that before we even discuss it, that all the other potentially involved parties got the same information, and they all concurred as well. So, you were talking about the cost savings to the citizens of not having additional cases of HIV/AIDS or hepatitis C or other things that we'd have to treat through public dollars, recognizing that some people would be treated through their insurance and private, but some of them would still be public. but it came across as if that was an offset to the cost to the county of providing this service. And I just wanted to be clear, because I've read in numerous Facebook posts and elsewhere that the county shouldn't be paying for this. So I want to make sure everybody understands the county is not paying for this. And if you'd speak to that a little bit, I'd appreciate it.
Yes, Health District receives no funds from the county to pay for syringe exchange. The Health District is not providing any funds to Blue Mountain Heart to Heart to fund syringe exchange. Health District involvement is through a contract that we have for HIV case management through the Washington State Department of Health and the federal government through Ryan White funds that direct and ask us to pursue HIV testing, hepatitis C testing in high-risk populations in unusual locations. So we need to seek out places where we wouldn't normally see folks as a health district. So we have staff that actually do that and try to get people who are at risk, who are not currently diagnosed or tested positive with HIV, other medications that will prevent their infection with HIV. It's called a PrEP program, and get them to providers for that as well. But these are things that we do at the syringe exchange, but we are not funding the syringe exchange. We are funding basically our own operations that are a different course of trying to reach those folks that are at risk. And we know that injection drug users are at significant risk.
And you would be doing that whether there was needle exchange or not?
We would be doing that whether there was needle exchange or not, or syringe exchange, excuse me. I want to make sure I use the correct term before Dr. Person smacks me.
And you made the comment that this fits within the Washington opioid response plan. I'm not an expert on that plan. Can you speak to that just a bit?
I think I'm going to let Doctor speak. She'll speak better to that plan.
Sure. So the opioid response plan was developed to respond to the public health crisis of opioid abuse, opioid overdose. So there are sort of four main areas. One is to improve prescriber practices as far as prescribing pain medications. The second is increasing access to treatment. The third is reducing overdoses in people with opioid use disorder. And the fourth is to improve data collection. Syringe exchange program is one of the things we're doing. It's not our only response, but in public health, a lot of times we're limited by what funding we have. So when we have the opportunity to provide a program that's been proven effective and that is necessary, we are going to take advantage of that. In Franklin County alone, if we look back the 15 years before we pursued this, hospitalizations from opioid overdoses and deaths from opioid overdoses had nearly doubled, deaths going from about 2.5 per 100,000 to 5 per 100,000, and hospitalizations actually almost tripling from 5 per 100,000 to 15 per 100,000. So not doing anything was not going to be an appropriate response to what was happening in our community. Even prior to our working on this program, we had requests from people in the addiction treatment community and in the infection control community asking us when we were going to get a syringe exchange because they recognize the benefits of this. This is a program that's nationally recognized by public health associations, by medical associations, by, again, addiction treatment associations, and we have treatment providers and infection control staff that have provided us with letters of support because they recognize the value of this program.
So, Dr. Person, in your years as a physician, is that mostly in the public health arena? I honestly don't know your resume well enough to know.
My arena covers public health, pediatrics, adolescent medicine, and urgent care, so.
Okay. And would it be fair to say, and if you don't want to respond, I'll understand, but I won't be offended if you do either. Of the 6 Board of Health Commissioners, is there one in particular that tends to push back on you and your programs?
I will say that there
More
is
than the others?
probably one that asks more of the, a lot of probing questions, so,
Sort of
and that would probably be
a challenging
yourself.
approach, right? Yeah. And do you recall when you brought this up, what I said about it?
Yes, I mean, I think, you know, as, well, I think you, as other of the commissioners, have indicated that you may have initially had personal reservations, but as you saw the evidence unfold and you saw the benefits of the program, particularly in terms of reducing infectious disease, and then also being a way to help people who with substance use disorder think about accessing treatment, that you recognize that despite your personal reservations, you understood the public health and the community value of the program.
So I think that's a fair summary. Thank you. Do you also recall in a more recent meeting me telling you that I was spending time sitting in the parking lot across the street calculating how long people stayed in the building to get a sense as to whether or not it was practical for them to actually be receiving any offers or discussion of treatment?
Yes.
Yeah, okay. So I bring that up because I want people to understand that there's been a lot of reservation, I think, on the part of more than one member of the Board of Health. And I can't speak for the others, but I can speak for myself that as much as I have a personal opposition to the notion of doing anything that might be perceived as condoning or enabling unhealthy, illegal, illicit behavior, and I very, very much don't want to do that, collectively all the other, I'll say potential, because I said at the time, let's give it a try, and then I'm going to come back and ask you to show us data as to what we've learned, and if it isn't helping people, if it isn't steering people to treatment, then I'm going to remove my support. So that's coming up here in a couple of months. We'll be having that conversation, I think. So I wanted to air that a little bit, because for me, the notion of getting somebody into treatment is difficult, because they're not going to do it unless they want to do it, unless they're motivated to do it, and they're not going to be motivated simply because they sat down with us for a moment. But I also know that as thin as those opportunities might be, it's better than no offers at all. And if you get one person into treatment and save them from a life of HIV infection, then it's probably worth it. Not probably, it is worth it.
Right.
Just my view.
Because I think, too, one of the things that we are working on is also reducing the stigma. So substance use disorder, opioid use disorder, those are chronic diseases. They're not character flaws. They're not moral failings. The same way that I'm not going to deny a diabetic insulin because they're not following their diet properly. I'm not going to deny someone who is an injection drug user the ability to prevent infection because they are doing a behavior that probably is not in their best interest. And I think having them have a place they can start to feel that they're not being treated as second-class citizens, that someone is willing to see things from their point of view, which unfortunately is not always the case in traditional even emergency rooms or clinics, and that's part of our provider education. That's something I think, too, that the syringe exchange program offers is an opportunity to try to build that relationship of trust, because you're right, people aren't going to change until they're ready to change, but if we don't meet them where they are, we're not going to ever have that opportunity.
Okay, so are you done?
Oh, please.
First of all, the funding of it comes from the Washington State Department of Health and through federal grants, correct? Where's the funding come from?
So I would actually, at this point, I would actually like Everett Maroon from Blue Mountain Heart to Heart, they can answer their funding, because the health district is not funding the syringe exchange.
No, I know, but
So-
where's the funds coming
so-
from that's
So
funded?
as a nonprofit agency, Blue Mountain Heart to Heart has a different avenue toward funding than a health district would. So I think Everett would be able to clearly articulate where
We're
their
out of
funding
chairs,
comes from.
The mic, please.
I had the fortitude to bring my budget with me. Blue Mountain Heart to Heart has two major program areas: case management for people already living with HIV/AIDS, and prevention of HIV/AIDS and other kinds of infectious diseases. And syringe exchange is one of our prevention programs. Currently funding our prevention program is the Department of Health. We get a $20,000 grant from them per annum, and that pays for salaries and supplies and waste disposal. We have an in-kind donation from them to the tune of $12,500 for Pasco and $12,500 for Walla Walla, and that's a direct buy through McKesson. So I can go in through my account, and that only covers supplies, sharps containers, other kinds of what we call injection drug use materials like cotton swabs and Band-Aids. We do go through, I saw this online, we do go through 1,000 Band-Aids a month between Walla Walla and Pasco. Someone asked that question. I do have some funding from Pride Foundation that I can use at my discretion that I use to supplement. So that is a private foundation headquartered in Seattle. And for this year, I got $13,000 from Pride Foundation toward HIV prevention. With that, I buy HIV screening tests, rapid assay tests that give me results in 20 minutes. Blue Mountain Community Foundation, located in Walla Walla. Right now, I've got $4,300 from there that I can spend, also with pretty good latitude. $5,000 from Macy's Passport Fund. I have separate money, $27,819 to operate Syringe Exchange, our mobile syringe exchange in Oregon. Only Oregon. So that's Umatilla, Morrow, and Union counties. So we have a lot of money across the board to use for syringe exchange. It's something that we do because as we got more involved, we've been doing syringe exchange since 1998 in Walla Walla. Our original intervention plan that we gave to the State Department of Health estimated that we would exchange 3,500 syringes a year. That was 1998. Washington State was the early adopter of syringe exchange programs, so we've never had a lot of data to show big decreases. I was talking, you'll hear from Charles in a minute when it says time to talk. He ran the one in New York City. They adopted so late in New York City that they had a 60% infection rate with HIV among their people injecting drugs. We will never see that, which is good. We don't want to see that. We got in early enough. But the money is all from private and public sources, and we do have about $25,000 a year in individual donations. That is our complete discretion to use however we want under IRS rules. So we, I'm not buying a yacht or anything, but just, that's a joke. Come on, go ahead, give me a smile. But we are running the syringe exchanges, somewhere around $50,000 to $60,000 a year. And there has been a request from Asotin County for us to do syringe exchange out there as well in Clarkston, and so they did have one until 2012 when their funding ended. So this is something that,
So we do have tax dollars paying for a portion of this.
Not local Franklin County tax dollars. Yes, you do have.
But we are all taxpayers. That's the thing. It's a tax revenue that's being paid for the needles.
Yes, but there's no law saying that we can't use tax dollars
And
in
you're saying,
Washington State.
and you said that you can use this money at your own discretion.
Well, when
When it's
it's-
given to you for AIDS research or AIDS detection, why are you using it for needle exchange?
It's given to me for HIV prevention, to prevent new cases of HIV.
And is needles the only way you can catch HIV?
No, as I said, syringe exchange is one of our prevention programs that we run at
Okay.
Blue Mountain Heart to Heart.
Just want to make sure that people realize that Magic didn't get it from needles, Magic Johnson. Okay?
No, only about 10% of HIV infections in the United States come from injection drug use, currently.
Only 10%.
Only about 10%. But we see so many, we're trying to have this conversation about public health. And public health, I applaud people doing public health. I'm not trying to applaud myself. Because there's so many things that we're trying to do with it. So, as Dr. Person and Mr. Dawson already explained, when we reduce people having infections from MRSA to cellulitis or some other, response of using an unclean syringe, that's a public health, outcome, a positive outcome, because that person doesn't have to go to the hospital for treatment. And I will say, so this is an anonymous and confidential program, so I want to make that clear. We do not have data on how many people stay in treatment. Once we've referred them, we can refer them to treatment, and I have a letter from the head of Ideal Option in support of our syringe exchange program to show you if you'd like to see it.
And then how do we come up with this? The American Foundation of AIDS Research estimates that for every dollar spent on syringe exchange, $3 are saved in future care.
$3 to $7.
How do we come up with these figures if you're not collecting data?
Well, that's not the same. You're comparing apples and oranges. In
Well, I'm
2007, the American Foundation for AIDS Research was trying to get the federal ban lifted on syringe exchange funding.
Where's the documentation for this? That's what I want
It's
to see.
in my answers, in the footnotes, in my question, in my answers that I gave you to the questions that you sent. So if you go to those footnotes
Okay.
and you look up those sources, you'll find their exact study on how they did that.
So in May, when we started doing this, there was 980 needles exchanged, correct?
Yes.
Okay. And in September, we hit 17,000. And in November, we hit 20,000.
Yes. And in
we
December,
went above
down
that
to-
currently. In any of the months after that, have we
No,
went
in
above that?
December it was 18,000, and in January it was 18,300.
Okay, now, you made the comment that we're stopping people from being pricked with needles by doing this, but somebody has to pick the
Dirty
needle
needles.
off the ground.
Used needles. No one has, so when we.
The addicts pick them up to bring them in to exchange them, you just said.
No, we
That
did
they'll
not.
bring them in. Well, then where do they go?
If
They're just
someone
gonna-
comes into my syringe exchange and they have 50 syringes, we take them from them, we put them into an appropriate biohazard container, and we give them 50 clean syringes. They are now incentivized to bring all of their syringes back to us. If they threw half of them out on the street, the next time they came in, we would only give them 20 syringes.
Well, yeah, but somebody's going to pick them up to go get a syringe, aren't there? Or somebody's going to get pricked.
Random people don't tend to,
Well, then.
that's like picking up
What
cigarette
good is the
cigarette
program if
butts.
they're not getting picked up? If they're going to be on the streets, one of my grandchildren might get
We
pricked by
are
it.
looking around the building for syringes
They're only
and
going to be
haven't
around your
found
building?
them. I think they were found one time in April. Was that what you said?
They're only going to be
Yeah.
around your building, is what you're saying. These addicts just hang around your building?
So I think you're missing the point,
No,
sir.
I'm not. This is making our community unsafe, is
Sir,
my
it's making
point.
it more safe. We have fewer syringes being left in the streets because we've incentivized people to bring them back in to get new ones so that they don't get as sick as often as they used to. And that begins a relationship with them where they start to begin to trust us more and ask us for questions about services, and then we can start to refer them to other places. I wish that when someone walked in my door, I could hit them with a magic wand and make them
Oh, I'm sure
go
you
into
do.
recovery.
Yeah.
I would love that.
Yeah, I thought you were going to get us to feel like you do about the needle exchange, because no magic wand's going to do that to me.
It's a public health program. It has very well documented outcomes. I would love to share our data with you and the commission every month, just as I do with the health division, and have you look at, how many people are coming in, what they're exchanging. Our rate of return on syringes, by looking at our 2018 data, was 93%. So 93%, everyone, the industry is looking for more than 90. So we're right there with collecting them back. It's not creating another hazard for people in public because they're coming across syringes. We're lowering morbidity related to injection drug use. And we're helping people. We do HIV and hepatitis C testing. 2 weeks ago, we did 9 hepatitis C screenings. We had 5 reactive results. 5 people, those were 5 new cases of hepatitis C, not before documented. We referred all of them into confirmatory testing. Now those people can get treatment for that, and that helps them not infect other people, because hepatitis C is much easier to get than HIV. You can get it sharing a toothbrush.
So you're telling me these people that are using illegal drugs are responsible enough that they're going to take control and not infect other people?
They're taking the very first steps toward getting control back of their health and their lives.
Then they'd be off of drugs if they were doing that. The very first step is to get off of drugs. And I know
That's not the way
there's
medically.
people in the room here that would like to talk too. So
Of course.
There's one other thing that I want to talk about, and that is when I met with Mr. Dawson and we had a very good meeting about this, we talked the fact that you offer more than just needle exchange, and that's counseling. And I asked you, what % of the people coming in that are getting the needles in exchange are opted into counseling or talking? And I asked you, and you didn't want to answer it, and I said, well, is it 20%? Is it 30%? And you told me what % are actually engaging in counseling.
I did not give you a percent.
You said less than 5.
I said that 5%. People are 5 times more likely to engage in treatment from a syringe exchange than those people with substance abuse disorder who are not attending a syringe exchange. That is what I believe I said, or at least that's me. If I didn't, that's what I intended.
So we don't have counseling in the syringe exchange itself. We refer people to outpatient counseling. We refer them to recovery associations. We refer them to LORDs all the time, and we have had on a regular basis LORD staff come in during the shifts when we are the once-a-week shift when we're doing syringe exchange, to be there on hand to help people with answering their questions about getting into recovery or starting that process. So that's it. But the other thing I want to say that other people here are not probably going to say is that more and more now the state of Washington wants to see a syringe exchange in a county in order to give the county future dollars around opioids. It is increasingly a critical piece of the network because we're finding people coming to syringe exchange that we don't see anywhere else for maybe months or years. Someone coming to syringe exchange can be seeing us, and we won't see them in the emergency department for a while. So this is an early intervention. It doesn't sound like an early intervention if someone's using drugs, but it is in the big scheme of where they're at. So for Franklin County, should consider, in addition to the public health benefits of having syringe exchange, that this is a critical piece of the infrastructure that you will need going forward for many of the grant programs and cooperative agreements coming out of DBHR and Healthcare Authority. So because the state has said, we acknowledge that syringe exchange is a vital piece of dealing with the opioid crisis. Thank you.
Mr. Murray, before you step down, do you mind?
Yeah.
One of the things we were told is that prior to an exchange being established here, that it was documented that some number of people, I don't recall the number, it probably doesn't matter, were driving to Walla Walla and or Spokane and or Yakima for exchanges.
Yes.
Do you perceive that there's a public health or safety risk in that behavior?
I do, and I did at the time, and I think it was part of my conversation with Benton Franklin Health District and the health officer. There were approximately 24 people, so one of the things that we do is we might be anonymous and confidential, but everyone has a unique identifier. So we know what an exchanger is doing from one visit to the next. And I look at those trends. Are they exchanging 200 and then 180? Are they going down? Are Are they trying to ask for more? How often are they coming in? What's the demographics of, who's seeing us repeated times and who only comes in once? And that's one of the things I would love to fix about syringe exchanges, get more people to come in more than once. Because I can't work with them the way I want to work with them if I only see them once. But we had 25 people, I think, coming all the way down, making an 80-mile round trip. I was very concerned about them being on the roads. I was concerned about driving through weather. I was concerned about what it meant in probable overuse of the same syringes while they were waiting to make their next trip to Walla Walla. And now I can see from those unique identifiers that none of those people are coming to Walla Walla anymore. Those 25 people, or most of them, are using the Pasco Syringe Exchange exclusively. But what also happened over the 8 months that we were, implementing the program in 2018 was we saw 332 separate individuals come and use the program. 59% of them one time. But that means 40% of them came more than once and started that relationship with some social service provider. Some of those people have deceased in those 8 months due to overdose. Some of those people have gotten into recovery and stopped back into the office and congratulated us or sent us an email saying, I'm doing great. Some of those people continue to see us and are, just staying in the program, but not necessarily moving in any particular direction. But I thought at the time, based on a study that was done in New Mexico, because New Mexico is a lot like Eastern Washington in terms of where our towns are situated and how much rural area we have between towns, that for people coming in, they would only come in about like a 50-mile radius, and that they represented roughly 10% of the total drug-using population. And so it makes a lot of sense to me that those 25 people turned into 332 people in 2018. There was a user population already present that had zero services in Franklin County and that had a lot of distrust, and that's why you saw those numbers go up from 980 to 7,500 to 10,000 to 20,000. As trust got built and people, because they know each other, they talk to each other, they use drugs together, they communicate with each other in a network. And as we built trust with them, then we started seeing them more. We did not create new drug users in 8 months to the tune of 210 people. They were already here.
No, but the whole point about the travel, you just hit it. They're coming from 50 miles away. What's it even mentioned for? That you're going to get people off the road. You've already said they're coming from a 50-mile radius. They're on the road to get the needles.
But they're not coming down to Walla Walla anymore because they have it here.
So
they're not on the road for 2 hours.
Are around that building, is what you're saying now.
In the Walla Walla area. And if you want, I'll show you.
They don't drive. They don't drive to your facility to get the needles.
I still see people from Milton Freewater because there's no...
Hey, that's my point. You're not getting people off the road, so don't use that excuse.
I am getting people off the road. I had 25 people stop driving to Walla Walla. 25 people aren't people? They're people.
Well, we got 2,000 needles being given out.
That's why we're going to start...
Where are those people coming from?
They're here. You can look at the data.
They don't drive to get the needles.
No, they're all local. I mean, you've got people...
Point.
You have a couple of people coming from Prosser, and you have a couple of people coming from Burbank, which is practically Pasco, and you've got, Kennewick and Richland folks coming in.
The whole premise of not being on the road.
Well, that doesn't mean that they have to live within 1 block radius of the.
But the whole premise that they're not going to be on the road is ridiculous.
But
they're on the road to get the needles.
Sir, they stopped using the road to get the needles down to Walla Walla because they have it here. So we did the goal.
This argument's going nowhere.
Thank you. Any other questions?
Thanks, Everett.
Yeah, just one follow-up.
Yes, sir.
Do you think that the existence of this program has a high probability of getting at least one Franklin County citizen into long-term recovery?
Yes.
Then it's worth it to me. Thanks.
Thank you.
Anything further for Rick and Dr. Person?
I have for the commission talking points fact sheets from the Department of Health, a letter of support of syringe exchange from the Department of Health. We also, in the last couple of days, have received emails from the infection control director at Lourdes indicating support of the syringe exchange, and from the Walla Walla VA infection control person as well, if you would like those.
All right, thank you, Judy. Thanks for coming over and sharing your time with us.
I know how to make copies of those.
Ideal Options.
Treatment provider.
Okay, the doctor and Mr. Dawson and Mr. Maroon were all three asked to give us a summary for the background of the needle exchange. We have, I don't know, 8 or 10 more people that want to speak. I'm going to limit it to 3 minutes. And if it's a repetition, you can just say, I agree or disagree. So it'll help us get through this in a timely fashion. The next one on our list is Lisa Thompson. I'm sorry, Thomas. Yeah.
I did email you guys. I don't know if you want another copy or.
I don't need another copy.
We've got the email that you sent.
Hello, my name is Lisa Thomas, and I'm a registered nurse, and I have 3 children. I've worked at various healthcare settings now for 30 years. Early on, I worked next door at Lourdes at their inpatient drug and alcohol treatment unit, and also at Harborview Medical Center on their neurology neurosurgery floor. We dealt with a lot of addicts. I'm not going to give it a different name. It's addicts. We had famous people there, homeless people there, people with mental illness and drug addictions. I learned a lot about addiction and treatment, and some things never change. An addict will only seek treatment when they are ready. And not having access to their drug of choice can facilitate their desire for treatment. We are compassionate people. Everyone here has good intentions, but there are different philosophies to help addicts. And I've watched one philosophy dominate using liberal media like the Herald or those invested, and I would call that philosophy enabling. There's another approach, and I believe you're aware of it, and it is called not enabling. Aside from the program being enabling, it is also allowing illegal behavior, some of which are felonies. If you don't have a doctor's order, it is a crime to have a needle. It's a crime to have a syringe if you do not have a doctor's order. And they're handing them out knowing what they're going to go do with them. That's a crime. They are also providing a very powerful medication called Narcan, which is used during a sentinel event in a hospital. I feel this puts the county at a liability risk. If somebody overdoses or dies, the county could be responsible. This doesn't have the success that they're stating. Grays Harbor County just ended their needle exchange, and they said, this is not the government's role. That's their quote. This is not the government's role. Blue Mountain operates here out of Walla Walla, which is a liberal town, and it's pushing its ideas onto us. Walla Walla just passed a voice ordinance law so that you don't have your voice too loud or too quiet in the town. It makes a Walla Walla, and they call it heart to heart. It makes a lot of claims regarding its services, and its biggest claim being here is to reduce transmission of blood-borne pathogens. The fundamental flaw with these programs is there is no proof that these exchanges actually reduce infections. And I researched it again this weekend, nationwide or locally. There are no studies proving these needle exchanges do what they say. The exchanges want us to assume that one addict is using one needle one time and then neatly putting it away. They're supposed to turn them in bundles of 10, but they're giving out little red Sharps containers that they get to use. So you actually, now that I think about it, how would you physically count the needles in that Sharps container? It's impossible.
I would love to invite you to come to the syringe exchange during one of our shifts and watch us work. I'm happy to have anybody here.
Okay.
Okay.
I'm speaking.
Let's not get in the middle of that.
So they're supposed to put them in a 10-needle bundle and return them that way, and they're not even doing that. I don't know how you could even measure what's coming and going if they're turning in just a red Sharps container. You can't count. Thank you. The needle exchanges are enabling more needle sticks, more needle availability, and more prolonged exposure to becoming infected. If they want to be the Department of Health and they're worried about overdoses, then just supply Narcan.
Okay, Lisa, your 3 minutes are up. If you got it,
Okay.
if you got it written,
I do. I just have two
leave
more.
us a copy.
Okay.
I'd appreciate that.
I mostly would just really question the claims that they make because it's immeasurable. And I think we're a compassionate society. If they want to be there, I think we need to have on-demand treatment, treatment for addiction. And they stated they don't even have that there. Thank you.
Thank you.
Thank you.
Charles Eaton, please. Good morning. You can use either one.
My name is Charles Eaton. I have lived in Richland for the last 14 plus years. I ran the first government-approved and funded syringe exchange study in the United States for the New York City Department of Health in September 1988. It was thoroughly evaluated with these results. Fewer syringes discarded in the community, more recycled through the syringe exchange. 2, help getting into treatment was the most requested service. We were able to get users into treatment faster than an individual could do it on their own. Our program was then called a bridge to treatment. We got users medical care when needed. Users of the syringe exchange had lower incidence of blood-borne diseases than non-users. Users of the syringe exchange had lower arrest rates than non-users. Every syringe exchange which uses best practices has been evaluated has had similar results in my 30 years experience. It is of interest that the first effective syringe exchange actually predates my work in New York City by a few months, was government funded after operating for 6 months, and is still functioning today in Tacoma, Washington. I would be happy to answer any questions.
Questions for Charles? Thank you, sir. Next on the list is Nadine.
My name is Nadine Pulfer, and I'm a physician assistant, and I've worked with the substance use disorder population, specifically in the Tri-Cities area, for the last 8 years. And I would say that my training at the University of Washington Medical School showed me that people with all manner of disorders, substance use disorders, diabetes, COPD from smoking, all those things. Nobody quits cold turkey. My brother didn't quit cold turkey. He's dead. They take their time. They contemplate. They require a conversation that is ongoing. And their ability to come in with their needles and to be exposed to people who are non-judgmental gives them the opportunity to discuss their concerns. It's not an easy thing. Opioids are terribly hard. Just like smoking is hard. It's a hard thing to do, and they need support and assistance. And the syringe exchange program is a brilliant opportunity to do it. And I would suggest, Lisa, that if you couldn't find it there, that the University of Washington Public Health Department has excellent information about the substance abuse disorders, which you may find enlightening.
If I can answer that. No. If this was such a great program, why isn't everybody in the whole wide world using it? People like you. I'm not against it.
Okay. Was that all, lady? Okay. Madeline Brown?
Hi, my name is Madeline Brown, and I am from Walla Walla, where I have had the opportunity to see Everett's work in action. There are people here who are doctors and physicians. I've been doing this since 1988. So I am here specifically to speak on who the biggest populations are who use opiates. In particular, there are other drugs that people use intravenously. I have experience and training with people who have adverse childhood experiences, which are called ACEs. Basically, people who, from in utero up to 18 to 20 years old, have had some severe and traumatic experiences. We know that the more traumatic experiences children and young people have to face, the more likely they are to have basically every single negative health outcome. So one of the things that these young people face is PTSD from these experiences. And unfortunately, people do self-medicate when their life is out of control. It's one of the few things that they can control. Unfortunately, this does lead to, it can lead to intravenous drug use, but the programs like Blue Mountain Heart to Heart helps mitigate the likelihood, one, that they will get HIV or hepatitis A. It also gives them the opportunity to talk to someone in a non-judgmental way. I actually have a student that I worked with who used the Blue Mountain Heart to Heart, and through that, she found out where the closest rehabilitation facility was, and she was able to be taken out of her incredibly toxic environment and put into a safe environment, and she has now been clean from intravenous drug use for 5 years, and she has a wonderful life that she's building, and it wouldn't have been able to happen if it wasn't, thank you, if it wasn't for the programs that Everett facilitates for these communities. We can't hate people into not using drugs. We have to facilitate their rehabilitation through whatever means that we can, and one of those ways is by providing non-judgmental services like the needle exchange program, the naloxone program, and the other programs that are held in the same building as the Blue Mountain Heart to Heart in Walla Walla.
Thank you. Next on the list is Jeffrey Robinson.
Oh, my back problems never change when you get older. Hi, my name is Jeff Robinson. I signed.
Yes, they do. They get worse.
That's what I love about you. You keep it fresh, Brad. I actually have a background working with foster children and at-risk youth, and I chose to sign the ledger to testify or to communicate today because I find this meeting very concerning. I find it concerning when a professional gets up here and you interrupt them every 5 seconds with facts that I have no idea where you got them from. I find it concerning when I have medical professionals that are up here and it looks like a Spanish Inquisition. I find it concerning as both somebody who has to deal with people like this in their professional life who need this help and who also is a member of the community, when a commissioner takes it upon themselves to act like the judge, jury, and executioner. I find that concerning. You have been given fact after fact. So has this nice lady over here. You have had medical professionals. You have had more resources, my God, than the average citizen could dare to dream of outside of an emergency room. And your response to these things is to ask very nasty questions and is to kind of get in people's face. That's what you think a commissioner should do, huh? I'm impressed. I had thought that I, of all people, was the most difficult in the room. But God bless you, you really showed me something.
You are. You're still important.
I love you too, Clint. Maybe we could get a beer sometime. But for the love of...
I don't drink beer.
Well, you must be drinking something with some of the questions you ask sometimes. Anybody else are you going to accuse me of? Oh, give me time. You'll do it for me. Anyway, I would just ask, when we have professionals up here, that we act like adults. We don't ask questions designed to be gotchas, and we don't interrupt them. Act like a damn adult. You got elected for a reason.
Thank you.
Thank you.
Thank you.
Ron Van Dinter, is that proper?
This on? Name's Ron Van Dinter, longtime Franklin County resident, and very concerned. Some of the stuff that I've been hearing in this is a staggering amount of syringes that are given out per month in the Tri-Cities area with what is my opinion, no accountability as to what does come back in. I'd like to see some accountability on that other than what Ms. Thomas pointed out to me was how can you verify what is in a Sharps container when they turn them in? Is it true that somebody could walk in with one syringe in there and walk out with 10 syringes? Is that true? Could you answer that?
As per CDC guidance, saying that we should not break open.
Right, but just yes or no, is it possible that somebody could walk in with one syringe and walk out with 10? So with the multiplication factor of that, the amount of syringes coming back in and the amount of syringes that are going back out on the street is staggering to me.
That's not what we see in the data.
A program like this, you have to weigh the risk of it versus the benefit of it. And to me, the risk of that many needles on the street and in the hands of people that are already of a compromised decision-making process, it's staggering to me. Second off, I've heard you guys say words like manage and mitigate, but I've also heard you say anonymous and completely confidential, meaning really not any accountability. So how can you manage somebody's HIV without any accountability to what they do other than the time that they're in your office, okay? And I would like to read a story that I found in about 2 minutes' time about these type of programs. Excuse me, I got to get my cheaters on here because
Yeah, you got about a minute, so.
Like I said, the benefit versus the risk is what determines if the program is a success. This is a story that was written by the CDC and published by U.S. World News and Report, and it was published in the CDC's Vital Signs Report. And I will just read what it said exactly. The findings published in the CDC's Vital Signs Report show that the percentage of people who shared unclean needles for drug use on an average in 2015 was about the same as it was a decade earlier, meaning this was a decade-long study. At roughly a third of the users who injected drugs, this occurred even though more people are using syringe services, which provide free clean syringes to drug users and connect them to other treatment and prevention methods like overdose reversal drugs. So the assumption that people are not sharing needles because they're getting clean ones is incorrect. And this study proves it by the CDC. I'm not saying, this is fact. This is a study done by the CDC.
Yeah, okay.
And so I would just like to point that out. And also, I would like to, one more question for them. In regards to Mr. Peck's question to them, is it possible that a person could walk into your clinic and receive a needle and overdose with your needle? Is it possible?
Many things in the world are possible.
Is it a possibility, though?
Of course.
Well, then, this clinic is not worth it to me.
No.
Excuse me, could you give me anything else on that report? You said it was the CDC vital signs report, maybe just a month or a year or something, so I can look it up?
This is what I posted on my Facebook that I just copied and pasted it. I'd have to go back into the research page that I found it on.
Okay. Was it published by the CDC or by U.S. News?
It was published by CDC, reported by U.S. World News and Report.
Okay, great. Thank you. I'll look it up.
Brad Casper, please.
He had to leave.
Okay.
Trevor Hummel's going to take his spot.
I'm Trevor, and I'm a former opiate addict and user. I'm clean now. People don't get help until they seek it and have to do it for themselves. Even once they go to treatment, the relapse rate on that is outstanding. They need to follow up with things like NA, which is a free program, and it's just enabling people to do the wrong thing. The crime rate on people that are using needles is outstanding, because if they're making a poor enough decision to use a needle, then what else are they doing? And as far as them using clean needles, if you go to somewhere that people are using drugs, they all share those needles. I've witnessed that firsthand. And so,
Trevor, you spent time in the prison, and you made a statement to me that that's the only way you got clean.
correct.
Was you got locked up.
Right, because of legal issues, I went to jail and got clean, and then after that, sought help for myself.
Yeah. And then you also made a statement that the SNAP cards that are being given out.
Right, it's just like food stamps, people pawn those off for either owed money for drugs or 30%, 50%, so it's just another thing that enables people to keep doing the wrong thing.
How do you spell your name?
Hummel.
I did it right.
Thanks, Trevor.
Thank you.
Yeah, congratulations, Trevor.
James.
Morning, everyone. My name is James Jimenez, and lifelong Washington State resident and the majority of Franklin County. Just want to show my opposition to the syringe exchange program. It's my understanding that it's over here at the WSU Extension office where my kids are in 4-H, all three of my boys, and we have young little kids in that facility. That's, I guess, where they chose to do it. Just showing my opposition. Thank you for your time.
Thank you.
That ends our list. So, must be a different list than I got.
Did you sign the book or the case? The book. Okay, the book is loose here.
Okay, Carol.
Carol, feel free to come up and speak.
Good afternoon, Commissioners. My name is Carol Moser. I'm the Executive Director of Greater Columbia Accountable Community of Health. First of all, thank you for allowing this public discussion to happen on a very important topic. Greater Columbia Accountable Community of Health is part of a statewide initiative called Healthier Washington that is addressing the opioid public health crisis. The best model of care to address this crisis is modeled after the Vermont Hub and Spoke, which recognizes the many pathways that need to be available to people seeking opioid use disorder treatment. Syringe exchange programs are a vital pathway for people with opioid use disorder. and would be a part of Greater Columbia ACH's own program. We recognize that there is a huge stigma around people that have behavioral health issues such as mental illness and opioid use disorder. And these are barriers to people seeking treatment. But until we break down some of those barriers, people will not seek treatment and will continue to overdose and die unnecessarily. And I think we might all know people that have opioid use disorder. Unfortunately, my sister's one of them, and she started by having migraine headaches and got onto opioids as a result of that. And I don't want her to die, and I want her to have pathways to treatment. The health system considers substance use disorder as a chronic disease. As health professionals, we seek to reduce chronic diseases such as diabetes, COPD, heart disease, and substance use disorder. Please allow the syringe exchange program to be used as a tool to address the opioid crisis in our own community. Thank you.
Thank you, Carol. Do we have anybody else that, yes?
Commissioners, good morning and thank you. My name is Wes Lucky. I'm the Deputy Director of the Greater Columbia Accountable Community of Health. I work with Carol and support what she says. Part of my role in the ACH is to do analysis of data. Washington State, the Department of Social and Health Services has a very useful, informative opioid dashboard where we can look at the county by county use of prescription opioids. And in our analysis, our organization, which extends from Pullman all the way over to Ellensburg, it covers 9 counties. Out of those 9 counties, the Tri-Cities by far has the highest number of individuals with opioid prescriptions and chronic opioid prescriptions. The data seems to show that a high percentage of those individuals may eventually transition into heroin use, which is unfortunate, but it's just a fact of the system. I'd just like to point out nationally in 2017, 70,000 people died from addictive drugs, and 2/3 of those were from opioids. That's more from car crashes, that's more from gun violence, that's more from HIV, that's more than the people in this country who died in Vietnam. So it's something to think about. We support this program. It is not the only solution. We need a systematic, system-wide response that includes hospitals, primary care, EMS, fire, police, and other organizations to counteract this very difficult issue. But a syringe exchange program is a very important piece of the program. Thank you.
Can you spell your last name for me, please?
Luckey.
Thank you. Did I see another hand, please?
Hi, good morning. My name is Cindy Hanna, and I'm a resident here in Franklin County. I just want to speak actually in support of the syringe exchange. The syringe exchange, I understand the stigma around addicts because my son is an addict. I've been able to get Narcan from the syringe exchange and have it on hand because if my son does overdose, I hope that he has a chance to live to get to treatment. Without living, he's not going to get it. And I hope that your children never become addicts because it's a horrible thing. And as a resident of Franklin County, I'm incredibly grateful to the syringe exchange for pulling dirty needles off the street because those needles have been here all along. They just weren't being disposed of. Thank you.
Excuse me, your last name again?
Hanna, Hanna.
Thank you.
Thank you.
Last call. All right, I don't see anybody else. Wrap it up?
Wrap it up.
Okay. That will move us on to a discussion with Mr. Sant. Good morning, Sant.
Good morning, Commissioners.
Congratulations last week.
Oh, thank you. It's been a busy couple months, so. There was an issue that came up before the board, and neither my office nor myself or anybody had noticed that that was going to be a topic of discussion. So I feel it was important for us to be able to be present, answer some questions regarding expenses related to our office training. We had provided, I'm trying to confirm with the board what information had been provided. My understanding is that there was some expenses, that there was some questions on relating to our all-day retreat from December 14th of last year.
So, Mr. Sant, if you'd forgive the brief interruption, I'll just tell you that since you asked the question, you don't know what was provided. As I read this, I thought that this was a different training session because the information you provided looks and reads much differently than what was presented when I was here, at least by my recollection.
So I guess my question...
By that, I mean there's a lot more training activity listed here than I recall being discussed.
Okay. Typically, we've always provided a training agenda as part of our reimbursement packet to show what was done on that particular training day. And just to give a recap, the retreat that my office follows, we coordinate, typically it's in December because usually December is a break from any kind of jury trials because there's a 2-week break right the week of Christmas, the week following Christmas where there's no jury trials. Typically, defense counsel and prosecutors alike recognize that jurors are going to be greatly inconvenienced if they're pulled in for jury duty and serve a long trial prior to the Christmas break, prior to time off with school with kids and things like that. So typically, we try to schedule well in advance so our employees have an opportunity to coordinate around their schedules. Employees know that this is a mandated training day where it's a one-time opportunity where both prosecuting attorneys as well as our training and support staff are able to coordinate working together. Throughout the year, deputy prosecutors are required to attend CLEs, continuing legal education training, where we maintain our bar license and requirements for that. Support staff will also go on a rotating basis to various trainings specifically geared to support staff. What we've tried to do with the retreat idea is to merge some of the training ideas where both deputy prosecutors and our support staff are able to work together, provide some training insights together, trying to make our office a better team environment. As you can imagine, we deal with a lot of life's worst situations. We're dealing on a regular basis, people killing each other, stabbing each other, things that are done to children that shouldn't occur, a whole variety of things. And so this is an opportunity for us to get together, try to figure out, what things can we do better. And one of the trainings that inspired this particular year for our training was Hope Inspired Leadership. It was a presentation done in connection with our Waco conference. 2 days prior to the Waco conference, WAFA put together a leadership training for prosecutors and their chief deputies to attend. One of the prosecutors that did a presentation was John Thunheim, the Thurston County elected prosecutor. He's been studying and doing this kind of concept for a few years now. And I thought after I attended that training with him, it seemed like this would be a great plan for, frankly, prosecutors' offices or really any organizational office to better the work environment, instill teamwork, provide open communication opportunities for people to feel comfortable in sharing their training methods. So anyway, what we did throughout this training started early in the day. John Thunheim came in from Thurston County, Olympia, flew in the night before to ensure with the weather. Again, we don't know what the weather's going to be like. It could be like this when we plan this out in December. We've had some very cold November, December months. So we typically pick a location, typically off-site. So one, we have a space large enough to facilitate this. I've tried to always find a place within Franklin County. If it's a place that costs money, I've paid that out of pocket. For instance, we've done this training at the Port of Pasco. Even though we are a county entity, they still charge us for a facility fee. I paid the $50 fee just to give us a location that's ideal for learning and away from the regular office environment. We bring in somebody that will cover our phones. We make plans according with the schedule to ensure that nobody has any court dates or court motion hearings, things like that, that could have been otherwise rescheduled. But unfortunately, there's always in custody matters that do have to take priority. So some of our staff or deputy prosecutors will have to prepare that paperwork away. But fortunately, this year we actually, I think it was the first time that I recall where we actually did not have any in custody matters that took our staff away. But anyway, I just wanted to give a breakdown of the training day that we did, because I think there's a misconception of what this is for. The first couple hours were from John Thunheim, and I think even our original schedule, we actually went beyond the 11:30 timeframe, because part of his training includes activities where individuals are filling out forms, they're kind of responding to a survey, they're identifying goals that they have, identifying some things that they would like to change. And these aren't necessarily just goals work-related, but also just getting people to think outside of the normal day of what can you do to make a difference. And bringing that hope-inspired leadership model to this has really kind of created a good environment for us that we plan on continuing throughout the year. One, engaging with employees. One of the things that I told them that I would be doing is meeting with our different groups in small groups settings, where I would probably take them out for pizza at my expense, just to kind of have that one-on-one meeting or a small group meeting and follow up with this initial training, finding out, hey, what is it that you took from this training? What now are some of the goals that we could apply? And one of the things that we're planning for this year's retreat agenda is just developing a strategic plan. And that's what John Thunheim has kind of instilled, is that this is kind of a first step of being able to broadly look at, where does your organization want to be in 5 to 10 years from now, and what kind of steps can you take. So part of that process is going to be follow up on my part with the individual staff and doing that. And from the feedback we got, it was a very worthwhile setting. It provided our employees an opportunity to share their ideas and actually put pen to paper, which sometimes when you're in a group setting and you ask people to speak about things, they're not going to share one-on-one. But kind of a moment of awkwardness, so to speak, was he had everybody kind of turn to their neighbor or partner and write out these questions, part of which was goals that they have and things like that. So we got to actually learn more about people within the office that we typically don't get to know. And what that does is it builds that team building. When you understand how other employees, what they value, you're able to work better together and recognize how, as an office structure and environment, how you can work better together. So I thought that was a very well worth training, and it was something that, rather than us going and sending people off to a training event where there's additional costs, we thought the cost of bringing in John Thunheim to us, where the only thing we had to pay for was essentially his lodging and the airfare to bring him over here, we thought that was a worthwhile expense to be able to cover that training. Because typically we would send people off, but it still doesn't address the issue that we always confront, which is we never have that opportunity as deputy prosecutors as well as the support staff to work together. So this training was designed specifically to try to get everybody to work together in that regard. And that's really important, because it's important that our support staff understand how the deputy prosecutors work, making realistic expectations of each other and trying to build from that. Following that training, we immediately went into a presentation from Ben Shearer from the City of Pasco. He's one of the longtime Pasco Fire Department members, provided first aid training. One of the concerns that we've had is that there's been some times where we've had medical situations arise here in the courthouse. And that could be any one of us in our own office, people having an undiagnosed medical condition. We have AEDs around the courthouse, but there was a question of, okay, AEDs. It's always been said that, oh, it's just simple, you just attach. But we all know when seconds count, and when people haven't had that individual training or experience, stress can be, kick in, and people are panicked. Even though that there's instructions on this device, it's like, hey, you attach a tab here, attach a tab there, and it'll give you advice. It'll say stand back, clear. We actually got that training from one of our Pasco firefighter members, and so he was able to go through, provide us that training, hands-on CPR training. I don't know if any of you have gone through CPR training where you used to do the mouth-to-mouth. Well, they've changed that, and it's different, and to me that was still shocking. I've been involved with the Boy Scouts and involved with the training of first aid there, and I've seen over the years how training has come with the compression time and things like that. So one of the things that Shearer introduced to us was an app. That's a local app that I think is kind of important. It's something that would activate on everybody's phone. So if you are trained, certified CPR or whatnot, it would actually say, hey, there's a medical problem at this location. And if you're close by, one of the things that he pointed out is that it's typically at least a 5-minute response for firefighters to arrive on scene to provide first aid or emergency treatment. So the person that came up with that app was trying to do it because they said that there's people out there in our community that have this training. Sometimes people are closer to a person choking, for instance, or a person having a heart attack. They could respond there within a few minutes, perhaps even under a minute, before the firefighters get there and start CPR. One of the things that this app does...
Mr. Sant, if you'll forgive.
Yeah.
The day is getting long.
Yes.
But
Sorry.
I also want to just inject a quick point in support of that. I know a young man who is an Afghan vet and a combat medic. And I don't know that he used the app, but he happened to be in the building and heard people screaming and rendered first aid and saved the life. So you're right, there's a lot of people around us with a lot of skills, and we just don't see it on their faces. So I think the app's a great idea.
So anyway, I'll be short. I just wanted to give the board a highlight of the day. So that was something that was started. We began our lunchtime as he continued with the presentation, because basically he insisted, he's like, hey, got a lot of stuff to go through. Continue on, go ahead and eat, we'll continue to follow. So he was able to continue with the instruction with the hands-only CPR. A few in our group were able to take advantage of that, and he provided the other training and services that are critically important. One of the reminders that I thought was important, and it caught a couple of our people by surprise, was the reminder of the smoke detectors, not just replacing the battery on a regular basis, but actually there's a shelf life, so to speak, for the workability of smoke detectors. And he said it's been unfortunate. They've had a couple incidents in the Pasco area and extending outside within the Pasco Fire District coverage area, where they've gone to homes and their fire detectors were expired, essentially. So there's like a 10-year lifespan. There's a date that's on the detector. So it gave a lot of us an idea to go home and not only just check the battery, make sure the battery's fresh, but actually that the detector's fresh and working. Going on, we transitioned, and we're going to be presenting the board, I think, shortly. We've been working with my chief civil deputy on working with this group called Go Team Handler. They're dog handlers they do therapy dogs. One of the most difficult kind of cases that we deal with in the prosecutor's office are crimes involving child sex cases. Sometimes these kids are so young they won't even open up to us when we're trying to help them. Even to first responders, they have a difficult time opening up. So what they found is that animals can really inspire these kids. They could empower these kids to open up, and that's kind of the first step that we need, because sometimes we're trying to meet with the child just to figure out and evaluate, do we have enough evidence to go to trial? So one of the things that we wanted to do is give the members, make sure everybody in our office was comfortable with this group. So they brought in, I think we had about 6 dogs that came in. In fact, after our training at the Port of Pasco, actually allowed them to be part during Christmas time, a very stressful travel time for young kids. They allowed this group to come in through the airport, let kids kind of de-stress, so to speak, and work with the dogs. But we're hopeful that in working with our risk pool and making sure that we've outlined any kind of risk associated with, bringing animals in and having them close. Obviously, it'd be voluntary by the kids' parents that would participate. But we wanted to make sure this would be a good program for our office. So that was part of our training day as well, to work with these dogs, kind of see how they behave. We actually found out that John Thunheim in Thurston County, they actually have a resident team dog as part of their prosecutor's office. It's a court-certified dog. That's a special next step training that would require additional certification, where they go into court. They're able to give the child comfort while they testify, but the unique parameters are the dog has to be out of sight, out of sound. The dog can't make noises. It's simply there at their feet as they're testifying. The jury can't see that there's a dog there, but that has been something that has proven very effective. So anyway, we wanted to see that this program would work, and so that was part of our day as we transitioned throughout the day.
I know when I was over at Harborview in the burn unit, there was a Labrador, yellow lab there on the floor.
In fact, what I was really surprised, one of the most calm animals that I saw in this group, and these are all from rescue, they trained them specifically from rescue, is a pit bull. And everybody thinks of a pit bull being this mean, fierce dog, but really it just depends on how you raise them and train them. this dog would be, I've never seen a dog do this, but it like laid out all fours, spread out, laying on the ground like that, and the most calm dog I've ever seen. And so, anyway, dogs are effective. They're effective for therapy, and this is something that I think is really important. We then transition. We've seen a lot of, I should say a lot. We do see a few cases coming in the airport. They've started a new program with trying to deter contraband. A lot of people coming through, even with concealed weapon permits, forget to check in their loaded .45 or other firearms as they go through. TSA instills a pretty significant penalty. It's like a $3,000 fine that they go through. We, of course, look at it and we have to evaluate, is this a relatively law-abiding person? Were they trying to do something different or illegal? Was there ill intent? So we actually got a tour of the facility that actually detects. So behind the airport security measure where some of this detection comes about with the contraband, including drugs, that has referred to our office, they gave us a short tour with the Port of Pasco Police and the TSA head there. And so it was able to give our employees kind of a first-hand look of the cases that we get to our office to see how they come in, to understand how that detection process works. In fact, the day of our training, they had just got it cleared and operational the night before, so the timing was good. And then at the end of the day, we were able to finish a tour over at the Aviation Museum. That was something that I paid for with my own personal funds, just because that was something that I think is important for our area, the history. I know this county has provided funding for helping facilitate that restoration process of the tower and the history there. I think that was really important. And again, because it was at the end of the day, our staff typically would get breaks throughout the day where they're allowed to have their break. This is kind of a unique training situation, and so those breaks that would usually be granted, we just continued on and pushed through. And so I think the issue that comes to the board is that we had requested reimbursement for the lunch that was provided for our employees because, again, this is a one training day. It would be extremely difficult for us to organize a all-staff training day more than probably the one time a year. We are trying to look at seeing the feasibility of doing a training day in the summertime as well, but it's difficult just because of the time of the year. A lot of people going out on vacations. We made sure that our rate of reimbursement was well under our per diem rate. The per diem rate for Pasco is $17. We went with a local vendor. I purchased some additional food to supplement the drink snacks for that lunch, and that still came well below the $17 limit. So I think we were trying to be frugal on the amounts. I purchased additional items out of pocket myself just to make sure that, you know, it's very clear. I put a lot of investment, not just in my time, my management's time, in making sure this is a good training day, but I wanted the board to understand I invest a lot of my money every year, too, out of pocket for the employees. It's that important to me. It's that important to my management team that our staff receive the training. So anyway, I asked the board to consider the reimbursement of the costs that were presented, I believe, previously, the cost for the food as well as the reimbursement for the one-night lodging and the travel expenses related to Mr. Thunheim from Olympia. Again, this was a valuable training day for our staff, and we are only able to do that really one time of year where we're able to have someone come in, answer the phones, man the window to handle that. And again, we tried to be very frugal on the overall cost and kept it well below the per diem rate. So I'm open for any additional questions.
I have to agree with Commissioner Peck that this was not what was presented to us a couple of weeks ago.
No.
That depth.
Not
at all.
So. And I apologize for that again. Jennifer was out in Walla Walla handling a case, a very challenging case for this county. I was in a murder trial, and I apologize that my
How
staff...
did we do on that case in Walla Walla?
Is that...
How do we do on that case in Walla Walla?
We could talk about that probably
Okay,
another time.
all right, we will.
So-
I got some questions.
I don't think it was your office that presented.
I'm sorry?
The last time this came up, it wasn't your office, it was the auditor that presented.
But I got some questions for you. We don't have a policy in place for this, correct?
What we tried to do is the only policy I found is...
I'm talking about the Board of Commissioners.
Right,
We don't
right.
have a policy in place because we don't have any other departments asking for this.
That's correct.
And then also, according to our consent item number 5 that we're going to okay today, in here it's about the tax home. Identifying an employee's tax home is critical because the employee must be considered away from his or her tax home for reimbursements of travel expenses to be excludable. also in meals. So we're in violation of our own policy here as far as, that's my whole point, is we're paying for a meal when we're not supposed to do that. We're in our own local area.
I'm not sure, Commissioner Didier. I think that exclusion may be referring to the federal taxability of it, not the legitimacy of reimbursement.
This here is
Also on that same theme, that it goes on to say that if you are appointed to that, and that is part of your work, that is.
It's the rules and revenue rules. It's stated in there, and it specifically says no food.
Mr. Geary, if I could address that, I think where that issue has come up, which I think I take the same position as Sheriff is here, he's been caught in the same position. There's been times where we travel to Olympia to meet meetings or whatever. One of the frustrations that both the Sheriff and I share is that when you go to Olympia trying to save county expense and you're able to have a meeting later in the day and you drive there from here, you are well beyond your travel area.
Exactly.
You don't have overnight lodging, but it would certainly be reasonable to stay in overnight lodging where your per diem would be fully paid for. But if you travel there that day, that's what that federal policy directs, that is, if you were to receive that, it would be a fringe benefit where it would be taxed. So in other words, there's nothing prohibiting the reimbursement or use of expense while on legitimate business expense, but it becomes a fringe benefit under the federal IRS guidelines, and so it does become a fringe benefit. This is separate because...
But just to be very clear on that point, it is reimbursable. It's lawful for the county to reimburse it. Simply determines whether or not it's subject to taxation by the IRS.
That's correct. And one of the things that I wanted to address with this particular reimbursement here too is again, we follow the guidelines similar to the Public Works Department, because the Public Works Department actually has a policy on reimbursement. They've kind of adopted it from a variety of sources. One is including an AG opinion back from like 1987, where it basically speaks of, is there a necessity, the business purpose, does it help conform, and is it consistent with that purpose of meeting? In other words, if we are having a meeting and food is an integral part of that training day, that is something that is balanced of whether or not that meets the public expectation. And one of the things we considered is if we were to grant, we have union employees, and so one of the considerations is that, well, rather than giving them their breaks throughout this training day, and they agree to this, we provide the meal. It keeps them from scattering out where we may have inclement weather, because like I said, we typically will do this in December. It avoids the risk of people getting delayed coming back and delaying our training day. And that's the thing, is we have a very short day. This was packed. This was probably one of the fullest training days we were able to get in, and it really made an integral part of being able to continue on through part of the training presentation when we were able to have the lunch there on site and continue doing that. So one of the things we did try to evaluate, and to your issue of trying to get a countywide policy, I know that has been discussed and brought up in the past. We've simply tried to find the guidance from both the AG's office, the state auditor's office, as well as our Public Works Department's own policy. I figured I didn't want to draft my own policy, because of course I would draft a policy that would simply say, hey, mandatory training for all employees and staff, we're going to provide lunch. So to me, as long as we're following the guidance that has been adopted from the AG opinion, from MRSC, their guidance on the meal issue of whether or not this is a legitimate business purpose, we try to follow that direction and ensure that it's covered. And again, that's why I provide a lot of the stuff at my cost on my own, just to show that, look, I'm trying to mitigate the overall cost. And even with the reimbursement that was presented, we were well under that $17 a person per diem. And again, that's what we try to do every year, is keep it very minimal, try to make sure that the employees are in a good learning environment, and we try to reduce the cost for any venue that we choose. If there's a cost associated with it, I've covered the cost. This year, the port offered, they have a conference room at the airport. They were able to offer that because they said that was part of their idea, is to make sure that it is a facility that's utilized for that training. We were able to actually connect with their PowerPoint presentation and whatnot. And I even brought the PowerPoint presentation I wanted to share with the commissioners, just to give you an idea of the type of training that was covered, because I think it'd be a great program for every department at a county level. And we were trying to explore that idea, because when I attended this training, I thought not only was this a good training just for my office, this would be a good training for organizations in our county. So that's why.
The whole
that's-
courthouse.
the
I'd like to
whole
do the
courthouse.
whole courthouse.
And I recognize that's going to be a difficult time to do that as all of us together, but I think everybody should try to coordinate a training day like that, because I think it's really beneficial, and it's certainly something that our organization has benefited from. We have to cover, one of the things that we also covered that I didn't mention was the rules of professional conduct. We are liable as attorneys, we're liable for the actions of our support staff, and so we felt it was important to also include in this training some of the issues. So if a support staff person receives a call from a represented client, they're limited on the type of conversations they could have with that individual. And so we felt that was an important coverage, because our bar license is on the line if they mess that up. And so again, that's the type of training we're able to do at a retreat, where we have both the support staff and the attorneys together.
And you understand where we're coming from, because we have numerous departments. And if they all come forward and they want, we're going to be asking the taxpayers for more money for, we call it a training day, but, we're visiting a museum and we're doing things that, there's training there, and it's valuable training. I appreciate what you're doing, and when you come out of your own pocket, that says a lot about you. And I think that until we put policy together, I don't think we should be funding this. I think if you want to do the training day, you pass the hat, and you, what is it, $323 is what it was, or something
Well,
like
I
that?
think for the airfare, the lodging, and then the meal itself, it's going to be approximately like $500, $600. I don't have the full.
That's what we're going to be reimbursing?
If I may interject, I don't think the auditor has any challenge with the training costs of the airfare and lodging of the facilitator, John Tunheim, is that his name?
John Tunheim.
Tunheim. I think the auditor was just questioning the meal and food reimbursement.
And it's in our consent items, and as I read through that, it brought it into question for me, because they need to declare it as taxable income. Correct?
I don't believe that's the case, because it's a directly work-related benefit.
We'll need an attorney for this.
We'll certainly look and clarify to make sure that, but because of when it's provided through the work rather than a fringe benefit under the IRS regulations, typically that's the.
It's just like us going to a lunch meeting when we're involved on our appointments, that meeting is at
I think we need to get a policy in place.
Well, but it's in there. If you are assigned to that meeting and it's a lunch meeting, you are eligible for reimbursement.
I think what Commissioner Cook is saying, and forgive me if I get this wrong, correct me please, that when you make it mandatory training, you select a location for the benefit of the training, that becomes a duty assignment, and that's their workplace for that day. And therefore, it's a lawful reimbursement.
That's correct.
Do we have a resolution, or is it just consensus?
And just further, Commissioner, I want to make it clear, we're not seeking additional funding. This was funding that we incorporate into our existing budget that we do for each year to include for training. And so this is not anything that's outside of our already approved budget. I think the issue came up because the lack of a policy specifically for the food reimbursement. The auditor's just exercising due diligence and wants to make sure that the board would
So these
concur
funds
with
are
that.
coming out of your existing budget?
That's correct.
Oh, okay.
That's correct.
Okay.
There's not a formal resolution that has been presented, but
consensus,
a motion of the board would be appropriate.
I previously made a motion that died for lack of a second, and I think it was frankly because we didn't have a full and complete picture of the details, so I appreciate you coming in and providing that. And so with that, Mr. Chairman, I would move for board approval for the reimbursement requested by Mr. Sant's office when this was first presented.
I'll second, since it's coming out of your budget.
Okay. All in favor?
Aye.
Aye.
Thank you. Thank you for your
Right.
time. Sorry to go into overtime here, but.
Thanks, Sean.
That's okay, we'll bill you. Our hourly rate goes in 15-minute increments.
Well, at least it's not 6-minute increments.
That can be arranged.
Time on our agenda for public comment. Anybody want to comment? Seeing none, we'll move on to approval of payroll and warrant registers. Do we have some today?
I am checking folders to see if we have any. This is the letter.
Coming up, I think.
And the answer is yes, we do have some today. We'll take a look and see what we have. Okay, Mr. Chairman, we have 4 items. I'll take them in as they're provided in the folder here. Move for approval of fund expenditures in the total amount of $368,042.59. Note for the record, this has been reviewed by the county administrator and has been signed off by 2 representatives of the auditor's office.
Second.
All in favor?
Aye.
Aye.
Next, we have salary clearing payroll and salary clearing payroll of 2 different types. Move for approval of these expenses in the amount of $222,616.11. Note that this has been reviewed and signed off by 2 representatives of the county auditor's office.
Second.
All in favor?
Aye.
Aye.
Next is salary clearing payroll and emergency management payroll in the total amount of $956,782.13. Also note that this has been reviewed and signed by 2 representatives of the auditor's office.
Second.
All in favor?
Aye. And lastly, we have vouchers from County Road and Motor Vehicle, total amount of $116,480.19. And also note for the record, this has been reviewed and signed by 2 representatives of the auditor's office.
Second.
All in favor?
Aye.
Aye.
Brings us to consent agenda. We have 6 items on the consent agenda this morning, or this afternoon.
Chairman, I'd like to talk about items 4, 5, and 6.
So, Mr. Chairman, I move for approval of consent agenda as presented with discussion on the requested items.
Okay. Discussion?
Item 4 is our, it's with our Darrell Banks. We're talking about no supplemented needed as expenditures are included in the 2020 approved budget amount.
Where are you at?
Oh, excuse me.
Must be 3.
I'm on 4. This is with Darrell Banks, and they're talking about the Juvenile Justice Center.
No, not according to.
I think that's item 3.
They changed. I've got them in my book here. Termination board. Oh, okay. And there'd be 3. Yeah.
Okay, Mr. Chairman, I'll just change my motion for approval to include discussion on any items desired.
Yeah.
Okay, so.
Second.
Okay.
Did you second, Chairman? Okay. In here, on this, we're talking about a personnel, we're talking about training for employment, right? Workforce development, employment training, and connected youth to workforce and innovation. We're talking about so many hours. Is this just one person, Keith, that is for this training?
It's my understanding it is just one person.
That seems like an awful lot of money.
Routine that they.
I seen Darrell Banks was here earlier, but I think he left due to the. But it just seems like a high amount of money.
That is a lot of money for one person.
And as I read through it, it says the contractor will bill actual costs for travel not to exceed $6,000.
Correct.
Maximum total amount payable by the counties to the contractor under this contract, it's a contractor too, shall not exceed $225,400. I'm thinking, of course, over here it says the career path services will include provisions for employment specialists 40 hours per week, and all associated benefits, supervision, and overhead will be paid at a rate of $7,715.51 per month, not to exceed $178,277. And I'm just curious. It just seems like a high dollar amount for one contractor to come in to help these youth find jobs. Just to raise the red flag with me, that's a high dollar amount.
Yeah, under compensation, section 4, as you mentioned, it's listed as a career path services specialist for up to 40 hours a week. That would indicate to me that it's just one individual.
And, it might be beneficial to hold this over for Mr. Banks. I'll say that from experience, the monthly amount of about $7,000 when you factor in benefits is still a healthy wage, but not out of the ordinary for this line of work. And I'd also note that contractor on page 3 shall not be paid for any services rendered unless and until they've been performed to the satisfaction of the counties. And lastly, and I'm looking for it, but I'm not seeing it, is that the contract amount is a cap, but it's a reimbursement for services over time.
Right.
Oftentimes, it doesn't go to that full cap, but again, not claiming to have all the answers on this, and wouldn't object to having Mr. Banks come in and answer some of these questions.
Yeah, I would.
The only other additional information I'd probably add to that is because it is a contractor, they're required to carry their own professional liability and commercial liability insurance.
Yeah.
It's a 2-year program. So split that number in half for a year.
That's
Yeah.
for the 2 years.
Yeah,
So
it's from February 1, 19 to 31 December of 20.
Thank you. That's because Benton County is on a biennium budget. They budget or sign one contract for 2 years.
They're talking about $112,000.
Yes.
Per. And that's including they got to buy their insurance. Okay, that sounds more reasonable then. Okay, item 5 is the adoption of the updated travel plan policy, and of course I've already brought up some concerns on that, and that was due to the paying for that, so that's been addressed. On item 6, we're talking about the adoption of the updated Franklin County purchasing card policy. Now, it says back here in the back that on this, if we have somebody that violates this, they could, regardless of what is determined to be material level of misuse found during reconciliation or audit, all violations of purchasing card policy shall be reported immediately to the responsibility county official and the county auditor's office. Discipline for improper use of purchasing cards will be the responsible of the card user's county official. A violation may be cause for corrective action and or disciplinary depending on the severity of the violation. This may include termination of employment and or criminal prosecution. Now it says may be, and I would like to see an addition there that if this happens 2 to 3 times, it's automatic. I mean, we've seen this happen before with these cards where they've been misused. For incorrect purposes, and I don't want to keep a tight grip on this because I don't want to.
Sure. Yeah, we've tried to, I don't know, split hairs is the right phraseology, but be delicate to the responsibility that a county official, an elected official has to make certain personnel decisions within their office. I would think if it's clear that there was an intent to defraud or this was done purposefully, that our elected officials would do the responsible thing and take immediate disciplinary action. There are times when it has been inadvertent or accidental, even though it's been an inappropriate purchase. It was an honest mistake, and the supervisor has some latitude in helping us determine if disciplinary action is appropriate or a reprimand or a reminder that the card has to be used with extra discipline.
And if it is an improper use, then they write a check to the county, correct?
Sure. Yeah, we would seek reimbursement if they.
And who oversees that to make sure that that check's been written? And
primarily the county auditor.
Okay. All right.
Yeah.
My question.
But also the independently elected official that's responsible for that position.
Yeah. I'll just add an observation. My days in the Department of Defense, when these purchase cards came out in the late 90s, we made it mandatory for young airmen who were traveling on government business to have these cards, and we had a number of cases where things were charged because they simply pulled the wrong card out of their wallet and didn't realize it. And we ushered some people, good people, out of the Air Force for honest mistakes. And we learned pretty quickly that delegating that authority and that discretion to squadron commanders was the right thing to do, and I think this is a perfect mirror of that, so I think it's the right way to do it.
All right. Further discussion on the consent agenda? Okay. All in favor?
Aye.
Aye. All right. Keith. Have for us this morning.
Yes. As I'm sure you're all well aware, through TRIDEC, we have been working for a number of months to get the regional governments, counties and cities to participate in discussion with our federal legislative delegation to draft legislation that would convey Army Corps of Engineers lands on Columbia River back to the municipal governments in which they are located. What I'm asking for your consideration today is authority to approve or sign, that the board would sign this letter directed to TRIDEC indicating our continued support for the legislation, and it lists out kind of several points that they asked us to consider when we drafted our response. Other cities, particularly the city of Pasco, is drafting their own response. Their meeting last night where they had planned on covering this item was canceled due to the weather, so I don't have an official resolution yet from the city of Pasco. But I have met with them and discussed some of their plans so we kind of have an idea what they're looking for. But the basic questions that they're asking us to respond to is what parcels of land are we looking at? We're essentially narrowed this down to the parcels that are along the Columbia River on the western edge of the county, basically from where the city of Pasco stops at about Burns Road and goes north to the Hanford Federal Facility. There's a number of parcels, probably 25, 28, we're not sure the exact number, but pretty close to that in that area that would be impacted by this legislation. They asked us to reaffirm our commitment to the tribes and to both federal and state environmental policies and laws. There has been some suggestion in the community that if we just get the feds out of the way, then we can do with whatever we want to with these parcels, and we have to kind of clear up some of that misinformation that we still are subject to state environmental laws in those parcels. So the letter is just to indicate our support, our commitment to work with this group, and hopefully this process can move forward.
So in this letter, does it also convey that the people that own the property are the ones that are going to get it back?
No, it does not specify that. This is only dealing with those lands that are currently owned by the Corps that would come back to the county in our situation, or the city as it relates to those parcels within Franklin County that are also within the city of Pasco. There are some parcels that the landowner's ownership goes to the high water line or the flood control line, but there are also lands where the Corps actually has the deed or the title to that property on the shoreline. And it's the latter one that we're really focused on.
So Keith, when you and I spoke on this, I recommended a bit of an adjustment to the wording, and I probably should have sent that to you in writing instead of verbally. But my recommendation was that in the second paragraph where it talks about reconveyance or conveyance, it references in the second paragraph, fourth line. It's talking about owned parcels that, fourth line, are located adjacent to the Columbia River shoreline along the western edge of Franklin County, north and west of the Pasco city limits up to the boundary of the Hanford Reach National Monument. My recommendation was that we would ask for reconveyance of all lands along the shoreline of Franklin County not owned by another governmental entity. Or not owned, not sought by the city of Pasco or owned by another governmental entity. The reason I bring that up is because at the extreme eastern end, we have state land back to Reyes State Park. And then as you come upriver westward, you get to the Port of Pasco, which is actually owned to the shoreline by the port.
Right.
And then you go from there into, I think, a section under the railroad bridge. It might be Burlington Northern, not sure, the railroad anyway. And as you move further west upriver, it is Corps owned, and those are lands that the city of Pasco would seek to have reconveyed with them. I'm aware that there may be some shorelands, principally those that are adjacent to private property, that the city is not, at least initial appearances, the city is not intending to request reconveyance of those. And it's my view that every person who lives in the city of Pasco is also a Franklin County constituent and resident, and that if the city's not going to request reconveyance of those, the county ought to, and that we can become the governmental entity that works to create a subsequent for-fee transfer to those private property owners. And when I say for-fee, take what the Corps paid for it, calculate that for the same value in present-day dollars, and make it available to those private property owners. I do that on the premise that if those other lands are no longer needed by the Corps for flood control, then neither are the ones along those private properties.
Right.
And I can understand and respect the fact that the city may not want to engage in that mildly complicated process of being an intermediary, but I know I feel very strongly, I suspect Commissioner Didier and Commissioner Cook do as well, that this is probably the one shot that our constituents are going to have at recovering these properties, and if we don't do this for them, I don't think anybody will. Yeah. And so, although it complicates the process, and that's unfortunate, I think we ought to write this letter to say that we're seeking reconveyance of anything along the Columbia River shoreline in Franklin County that is currently Corps-owned and not claimed by another governmental entity.
Okay, I think that's fair. We can certainly reword that to reflect that. And I think you're accurate in describing kind of the city's position. When I talked with the city manager, they seem to indicate that some of those properties were too steep to put a trail or a path through there, so they weren't really interested in trying to pursue that for city ownership. But I think what you're saying makes sense.
I respect their view on that, I really do. I think there's a secondary government interest, and I think the city's interest is the same as ours, which is facilitating a future transfer of those residents. And if, for whatever reason, the city chooses not to pursue that, I'd like us to be the backstop that does.
Okay. Speaking of a letter, remember last week when Glenn Stockwell came in and talked to us about support? I think we all told him we were not in a position to be putting a meeting together, but I think we could offer a letter of support from the three of us for the Columbia Basin
completion of the east and west highway.
Yeah, I'm absolutely in support of a letter in support, and like all of us, I'm sure I'd be willing to meet with him as well. Mr. Chairman, if I may, I'd like to go back to this letter with the Corps for a moment. We do have a letter that needs approval. What I would ask is that we go ahead and vote for approval as I've described, and then immediately after the meeting, I'll ask the clerk of the board to adjust this language, and then each commissioner can look at it, verify that it's what we agreed to, and then sign the document. Would that be acceptable?
Yeah, I'm sorry, I didn't mean to step in the middle of things.
Okay, so Mr. Chairman, I'd move for approval of the letter to Vice President for Federal Programs of TRIDAC concerning the reconveyance of shorelands from Corps of Engineers, Franklin County. And as I just described, I'll update the language. Each board member can confirm it's correct and then sign.
All in favor? Aye. I'm sorry, I didn't mean to get ahead of you, but so we'll put together.
And by the way, if I may, you now have the record for the meeting that ran the latest in the day. Never mind the fact we started 2 hours late.
So we'll get to work with Karen and put a letter together for consent for support. So, with that, it looks like we're going to go into executive session, but I don't know about anybody else, but I could use 5 minutes before we do. Okay, go ahead. Yeah. So, go into recess for 5 minutes. We'll go into executive session. Will be any decisions made, do you expect?
I'm sorry. No, probably not.
Okay.
Looking at my,
So
we'll probably just.
We'll
have
come out of executive
15
session
minutes.
and adjourn then if there be no decisions made. All right, we are out of a break right now and back into a regular session, and we're going to go into executive session, 4230, 110, 1I, potential litigation for how long?
Up to 15 minutes. I think we could be done within 15.
No, we'll put 15. We are back in regular session, out of executive session with no decisions made. Commissioners, do we have anything else for the good of the board today?
Mr. Chairman, just a quick update. I did go to Olympia last week for the Legislative Steering Committee meeting with WASAC. Spent time over on the Hill meeting with a long list of legislators seeking support for state funding of an updated juvenile justice facility, as we've discussed in the past and as I briefed at the last meeting that I would be doing. I also talked to a number of them about Initiative 1639 and legislation that might undo some of what I believe are the evils in that initiative. Personal view there, of course. I will tell you that there was a very clear delineation between people who had R's on their doors and D's on their doors. No interest at all expressed by anybody with a D on their door for anything with 1639. They thought the initiative was fine. On the R side, it was mixed reviews.
It was mixed on the R's.
Yep. I will tell you that my sense was that the mixed review on the R's was not that they felt that the initiative was well-written and a good initiative, but rather whether or not they thought it was a viable path given the current imbalance of power in all three branches in the state government.
Anything? Okay, Keith, Karen, we are adjourned. Thank you.
Current imbalance.